So what we've done is we've pre-allocated you to tables as you were coming in to this session this afternoon. So you should be with some expert facilitators who will help stimulate the discussion and create that engaging environment for you. We've also allocated some rapporteurs for the tables. I'm really sorry if I didn't tell you beforehand that you are going to be a rapporteur, but if you'd see that we have allocated some rapporteurs for each table. We just ask that you help us with getting the feedback back to us in WHO by documenting the discussions that you're having on your table. So the key objectives of this particular session are for us to have the discussion within countries, and you'll find that you're sitting with your country counterparts as well as people from your region. So it might not be your only people from your country, it'll probably be people from your region. So we have lots of Ministry of Health and Ministry of ICT delegates in the room, but we also have program people, we have people from the donor community. And we've tried our best to mix things up and to enable that interactive and engaging environment. And what we want you to do is to, from all what you've heard over the last couple of hours from the beginning of the day, to put it into practice. My colleagues will put on the tables what we're calling an architecture template to help with stimulating the discussion and focusing the discussion around particular themes. So we want you to think about your current landscape in your country around DPIs, both foundational and for health, and think through and document if you want on those sheets. Think through those specific capabilities that you have in your country and where you want to be. And then just have that discussion on your table, share and exchange ideas. But before we go into that, we want to do a poll. So I don't know if you remember when Garrett gave his presentation in the morning, he talked about these 7 health goals. And across the 3 days, we are focusing the discussion around those health goals, but we will be focusing on 3 key health goals, but we'll talk about that tomorrow. But what we want to do is put out a poll regarding the health goals. So we'll leave this up for a bit so that you can remember those 7 health goals. And then we want you to answer a question in the poll. Let's hope it works. And the question, and it'll come up on the screen in a bit, what goals are you trying to achieve in digital health transformation in your country? And this is focused around those 7 health goals, but we want you to respond around the ones that are really pertinent in your country based on your experience. So while everyone is responding, I would, like I mentioned earlier, you have expert facilitators on the table. Facilitators, we just ask that you help to create that an environment for your group to have the discussions around specific themes. And whilst we're doing that, I'll just ask Chris to bring up the slide that shows the different themes that we'll be focusing the discussion around and the questions we want you to consider on your table. So this particular session is to help break things up. We're all coming from lunch. We don't want people to fall asleep. We want you to really use this opportunity and have those conversations and engage and really think about how you implement what you've heard when you get back to your countries. And that really is the purpose of it. It's the start of a conversation that will carry on tomorrow. And we really hope that there'll be a lot that you can take out of the discussions. So, yeah. Chris will just put up the what we're calling the discussion prompts on the screen, and we just want you to use those prompts to facilitate the conversation in your groups and think through the questions, think through the answers regarding these questions. But I'm going to quickly call on Garrett to just give a brief explanation of the architecture template that you have on your tables that are being distributed now.
So we've shared this diagram, which is a reflection of health DPIs, foundational DPIs, and interoperability layer. And you'll recognize the logos from OpenHIE and also from the discussions this morning on DPIs at a foundational level. We want really this to be used as a conversation starter for those at the table. There are multiple countries. There are people from different agencies that are also at the table. And the intent is to have a reflection on the questions of the aspects of, is there a specific agency or entity that governs or is the authority for that specific DPI within your country? And are there criteria used to establish what goes in a registry, for example, and what doesn't? Are there policies or standards that are specific to an individual DPI? And are there capabilities that you have or gaps? This is meant to be a conversation starter, not an exam. It's really intended to get you all discussing at the table. There are at least 2 countries per table, which means there's an opportunity for discussion, reflection, and really identification of differences and lessons learned that you might have in the governance around the use of these specific DPIs. I think the other aspect is we have on the far right the ability for you to denote who may be leading an entire health DPI infrastructure. Is there an agency that leads the role of that? And is there an agency or other mechanisms that lead the foundational DPIs broadly? So I think please use this not as an exam and not as but rather as an opportunity to a conversation to start within each table. Feel free to write on it. We will bring an additional, using similar kind of language, we will be using the same sheet tomorrow, but we will have additional questions and we'll give you a new sheet as well. So, thanks.
Thank you, Garrett. We'll give, because we're running behind schedule, we'll try and wrap it up in 50 minutes to an hour. Hopefully that is enough time for everyone to, bring their points out and have the conversation. I just want to mention that the architecture template that you have on your tables is a draft. In case, I know some of you are like seasoned solution architects. This is a draft, like Garrett said, it's a conversation starter. It's not a final thing. And it's building on work that we're doing around defining the reference architecture for digital public infrastructure for health. Myself, Garrett, and Chris will be walking around the room. If you have any questions in your groups, please feel free to ask us, and we'll do our best to support you. Thank you. Sorry, and one more thing. For the rapporteurs, if you scan the QR code, there's a template to record the notes. It'll be really helpful if you can do that and upload it onto that shared folder so that we can go back and have a look at your notes. Thank you very much.
So on the LMIS, we're using Open LMIS. No shared health record yet, but we do have a centralized electronic medical record. And we do not yet have incentive or legislation for the private sector to be able to share the electronic patient records with us. Yeah, we've undergone several versions of the EMR. I think this, we're in the 3rd iteration or the 3rd version, which is a centralized one, and it covers all service areas, and we're now rapidly deploying it nationwide. For HMIS, we do have the DHIS2, which we've been implementing since, I think, 2013 or 2012. And then, yes, there is a system for the finance But the insurance part of things, the national health insurance part of things, and the medical record side of things, there's still some work to be done in terms of interoperability. We're also still trying to be able to extract data from the insurance data system into the national data warehouse. How many minutes do I have?
1 minute left.
Okay, we have the national database centralized for all the patients. Then we have a data warehouse separate from that. Then we don't yet have terminology services working on that. Also, we don't yet have the client registry. We do have we collected requirements for that, and we're planning on working on that this coming year. We do have a facility registry, which was officially launched this year, has been in development for a while. But we are looking at mandating everyone to start using it, including the private sector. So all this I've been reporting is from Zambia. Sorry, I forgot that we were on the same table with Kenya. So now on the Kenya side, facility registry has been existent. Sorry, can you help for Kenya side? Oh, it's a good. Thank you very much, and
do we have a second table that's willing to volunteer? Brilliant. Could the volunteer come up? Hey. Thanks. Stream. Very quick.
Okay, Felipe Aguilera from the Pan American Health Organization. We were in a table with people from the Americas. We could say that, as a summary, Trinidad and Tobago, Chile, and Peru are all working to improve their digital health systems. However, they face common challenges such as interoperability, data quality, and political instability, we could say. Trinidad and Tobago, for instance, has made progress in interoperability and has a digital wallet prototype, while Chile has focused on capacity building and digital identity. Peru, on the other hand, struggles with fragmented system and paper-based processes, but has recently launched an interoperability layer. To achieve their digital health goals, these countries need to prioritize interoperability, improve data quality, and ensure sustained political support, which is really important, at least for the region. Some common lessons for other countries embarking on digital health transformation include the importance of a strong, unified governance structure to oversee and coordinate initiatives, ensuring interoperability, as I said. Investing in robust data quality and security measures is essential to protect sensitive health information. Additionally, countries should prioritize capacity building and training to equip healthcare professionals with the necessary skill to utilize digital tools effectively. And finally, securing sustained political support and long-term funding is crucial for the success of digital health initiatives. That could be a wrap-up.
So we are the Latinos, sorry, you know, a lot of temperament. Okay, so one of the challenges that we were talking with, especially with the colleague from Chile, and I think is something happening not just in Latin America, maybe in Africa, please, because I'm working with 4 countries in Africa as well. And I want to put in the highlight about FHIR standard. We are part of the DIPC project right now with GIZ, trying to follow the SMART guidelines. And when we tried to implement in Peru, we couldn't find one developer that really could manage to work based on FHIR standards. And it's the same in different countries. We are here talking about interoperability, fire standard, but what about the local capacities? And the second point is, we are always trying to push about digital public goods. And I remember myself saying almost the same in the Global Digital Health Forum last year. The countries, like in Latin America, they don't like so much these digital public health goods because they already took many years in build a whole system. And sometimes it's a very big challenge when we try to really to transfer a module based in a digital public good. So that is something that we need to think about right now before we go into a project, and now we have to really to struggle with many challenges. Thank you so much.
It's great to see the exchange that was happening between countries, the discussion. I'm glad you raised that point about the lack of capacity, especially amongst developers, to work with FHIR. That's exactly what the track 1 are doing. So you'll note the really geeky people in the room before are all hiding away, learning to build all these apps on FHIR that will work within this architecture. So it's exactly for that reason they're here. But with that, I think we're running late on time. Derek, is it burning? Oh, your table would like to come. I think, can you hold that thought? Because this exercise will continue tomorrow. So we'll come to you first tomorrow. But with that, I think we'd like to break for coffee. It's now 27 minutes past 4. So if we can come back in 20 minutes, if that's okay.